Hello everyone, welcome to the 5th lesson of Health and Wellness for Older Adults. Today we're going to look at some other chronic diseases and conditions that many older adults are susceptible to. Okay, so here is a list of the many different chronic illnesses that older adults are susceptible to. So I'm going to let you guys go ahead and take a look at that on your own, and we're going to move on. So first of all, we have skeletal disorders. So these are going to be disorders that have to do with our bones and joints, okay? So these disorders can be very painful and they often restrict your mobility. So, and they typically will start to appear in midlife and just progressively get worse as time moves forward. Okay, so some examples of this is arthritis and osteoporosis. And like you'll see many times, like it's common among a lot of people, especially those who have rheumatoid arthritis, where it gets so bad to where like fingers will be like this. They can't actually straighten out their fingers anymore, and they're like locked in like this. This is actually what my grandmother goes through. So it's really difficult for her to even grab onto things and hold things. It's hard for her to cook. She can't do a lot of things with her hands, and usually she needs help. Okay, and typically she'll go through episodes where like her hands and everything just hurts so much, like her elbows, usually, and like her wrist bones, and a lot of these joints that she has, they hurt really bad. So this is really fairly common in older adults, especially when they're much older, because this probably started in midlife and they progressively got worse. So by the time you're like 60s, 70s, it gets pretty bad. So some treatment on this might be focusing on preventing further degeneration and controlling the pain and encouraging independence. So while they're able to still move around, it's really important to keep trying to allow them to hold on to that function, okay? Even though it hurts, try to control the pain, but at the same time try to keep them moving. Okay, because once they stop moving, then they start to degenerate even further. So osteoporosis is the most common type of osteoarthritis. I'm sorry. It's the most common type of arthritis in the world. Okay. So this is where the cartilage between the joints breaks down and bone spurs start to grow, and that causes a lot of joint pain. So they get a lot of bone growth. Okay, so some treatment for this would be aspirin, hot cold compresses, weight loss. Okay, if you're overweight, holding on to a lot, having to work through a lot of that weight is going to get really painful. So supplements may also be recommended, of course. There are plenty of herbs and vitamins and things like that out there that may help to relieve the pain and relieve some of the inflammation. Okay, I know turmeric is pretty good, and things like that. So you can also use splints and braces and things like that to help reduce the pain. So that's gonna, help kind of press down on the pain. And it does help, because I know my grandmother, whenever she has her episodes, she'll use some sort of wrap in the area that hurts, and it really, it reduces a lot of her pain. Okay, so also there's hip, knee replacement surgery as well. So rheumatoid arthritis. This affects more than joints and can affect your eyes, your lungs, your heart, your nerves, things like that. This can also this can lead to other chronic illnesses as well that might even have to do with kidneys. Okay, so anyway, 2 to 3 times more, this is 2 to 3 more times more common in women than men. Okay, so it's way more common in women than men. This is what my grandmother has, and it's terrible. It's caused by inflammation in the tissue lining joints. It mostly affects the hands and feet. Some treatment for this would be anti-inflammatory drugs. Doctors recommend rest and exercise, heat and cold as well. Of course, there are plenty of supplements and herbs, things like that that help. I know, like for my grandmother, she uses a lot of ointments for the just for the surface area to kind of help reduce pain, and then she'll take a lot of things, a lot of homeopathic medications and herbs and things like that that will help kind of reduce it a little bit. Surgery can be a last resort for severe pain. Okay, so then we have osteoporosis. This is an age-related disorder that reduces bone mass and increases the chance of fractures. Okay, osteopenia is a lesser degree of bone loss. Okay, the most serious effect of this would be a hip fracture, okay, which will affect the spine and can cause deformities, and typically this will happen when you have osteoporosis and maybe you fall or you hit something a little too hard, or you plop down on your chair or something like that. Calcium, vitamin D, physical activity, even estrogen supplements can help slow osteoporosis. Okay, so some treatment options out there would be medications that can help reduce the possibility of having a fracture, and then also some common types of medication that are available would be bisphosphonates. Okay. Next, we have low back pain. Low back pain is most often caused by straining the muscles, okay, usually while lifting. Spinal stenosis is common among older adults and is caused by osteoarthritis. Okay, it's difficult to determine the direct cause of back pain. Sometimes back pain doesn't even show up in an x-ray, like the cause of the back pain. It may not always have something to do with like a fracture or anything like that. So they might not be able to even find a reason for why you're having low back pain. But anyway, so some treatments would include a lot of exercise, ice, painkillers, possibly surgery, if they can find a reason for why it's, like that, and, surgery can help. Okay, yes, there is surgery. What they will recommend for the most part is a lot of occupational therapy. Okay, it's like rehab stuff, exercise, and things like that. Then we have foot problems. So foot problems increase with age. The skin is thinner on your feet and it's drier. Your toenails are more brittle. Calluses and corns are caused by friction. Okay. And then ill-fitting friction going on to like when your shoes don't necessarily fit properly. Okay. They might be too tight, or maybe there's a lot of swelling in your feet, so you're stuffing your feet in your shoes. So calluses and corns can be caused by friction in your shoes, or maybe your bones are actually out of place. Okay. Bunions usually occur on the big toe and can cause a lot of pain. Most foot problems are caused by ill-fitting shoes, so just shoes that don't fit right. So it's very important to get the right footwear, especially for older adults. No more high heels, no more fancy shoes like that. That will ruin your feet. Okay. Orthopedists and podiatrists are the foot specialists that usually do deal with these type of disorders. So then we have endocrine disorders. So this is all stuff that has to do with our hormones. Okay, so diabetes and thyroid problems are actually the most common type of problems within endocrine disorders. Okay, so let's look at a few of those. So hypothyroidism. This is a deficiency in the thyroid hormone. Symptoms can be very subtle. You might not really even notice that that's where the problem is coming from. So symptoms can be weight gain, lack of energy, maybe you have some swelling, and then also depression. So that was hypothyroidism. I'm sorry. So hyperthyroidism is having an excess of thyroid hormone. Okay, so hypothyroid hormone or thyroidism is having a deficiency in your thyroid hormone. Hyperthyroidism is having excess of your thyroid hormone. So this can increase your heart rate, and a lot of that strain can cause a heart attack. So now we're looking at digestive disorders. So a lot of these will be tooth and gum and mouth conditions. Okay, so oral health is super important for everybody for just overall health. Okay, tooth loss is not from advancing age, but from poor oral hygiene. Okay, it's not just something that happens when you get old, it's because of years and years of not really taking care of your mouth. Okay, periodontal disease or gum disease is a common cause of tooth loss among older adults, sorry. Medicare does not cover dental services. Actually, yeah, Medicare doesn't cover dental services, I'm sorry. However, usually the Medicaid program does, and if you are a dual beneficiary, so meaning you have Medicare and you have Medicaid, then you should be okay. You should be covered with your dental services. Anyways, okay, so saliva helps to keep the teeth clean, but once you get past a certain age, many older adults actually have dry mouth from a lot of the medications that they take. Okay, so this is a side effect of having so many medications for a lot of other chronic illnesses that you have. Dry mouth can keep your teeth less naturally clean, and then you're going to have tooth decay, gum disease, things like that, if you're not careful. So then we have stomach disorders. All right, so heartburn is the most common, okay, among older adults. Frequent heartburn is called gastroesophageal reflux disease, okay, GERD. All right, hiatal hernia occurs when the stomach protrudes into the chest cavity near the diaphragm. So it's like right around here. If your stomach, so some of your stomach is going to actually there's a hole in your stomach goes into the chest cavity. Okay, so, and when that happens, you are in serious pain. Okay, it burns really bad. Okay, so some treatment is mostly behavior modification. It's going to be eating less, walking after your meals, exercising, drinking a lot more water as well, wearing looser clothing. You can take antacids, and then there are some other medications that you can use, but always you probably always want to take the more natural route before you go into medications, because medications will have side effects and it could cause other problems for you, especially in old age. So constipation, the most common digestive complaint in our country. Okay. Constipation is not actually part of the aging process. Okay, but reduced physical activity and reduced fiber intake and taking a lot of medication. A lot of those medications out there actually cause constipation. They dehydrate you, and they make your stools a lot more harder and things like that. So as a result of like medication side effects and other symptoms from other chronic illnesses, you might have constipation. So many older adults will use laxatives, but that can create laxative dependence. So you don't really want to go down that route if you don't have to. Okay, you don't have to depend on laxatives to poop, right? So some treatment would include behavior changes and increased fluids and fiber. Okay. So next we have fecal incontinence. Do we know what this is? This is where you can't control your bowels. Okay, let me just put that right here. Like it just leaks out. Okay, so why does this happen? Well, it can be caused by diarrhea, or it can be caused by nerve or muscle damage. So if it's caused by diarrhea, then it's actually reversible. You can treat that, you can help it, and you can fix the problem and you're good, right? If it's caused by nerve or muscle damage, that's not really reversible. We can't really fix that problem. The best we can do is going to be medication, pretty much, or surgery. There's colonostomy, prosthesis. I'm not sure if Kegel exercises would help that very well, but exercising the muscles should do something. Okay, but typically increasing fiber and using Kegels and things like that would actually help a lot more if it were caused by diarrhea. Okay, circulatory conditions. So we have a few. Okay, so a few conditions that have to do with our circulatory system. So like our arteries and veins and things like that, right? So first we have claudication. This is caused when your leg arteries become narrowed. Okay, so they become smaller by atherosclerosis, and this creates a lot of pain for you while you're walking. Okay, then we have varicose veins, which rope blood vessels, which are those ropey blood vessels that you see in people's legs, and this can actually cause a lot of headache, a lot of pain and swelling in your legs. Then we have hemorrhoids, which are like varicose veins, but those are near the anus, okay? And this can be internal or external and can be very itchy, painful, and bloody, okay? Then we have urogenital disorders. So first we're gonna look at kidney failure. So acute kidney failure, this is kidney failure that's very episodic. This is a life-threatening emergency. And then there's chronic kidney failure, which is more of like a slower, gradual process that happens. And usually acute kidney failure, that's just an intense emergency. You have to go get rushed into the hospital. Chronic kidney failure, you kind of don't even notice it because it's like your body just slowly goes into it and you just keep slowly developing more and more symptoms. Well, you don't necessarily have symptoms that you notice, okay? They're more subtle. All right, so the causes of kidney failure would be high blood pressure, diabetes, and those are probably the main causes that are associated with kidney failure. Okay, high blood pressure and diabetes. So some treatment for kidney failure would be dialysis, which is probably the most common one that I think a lot of us are familiar with. This can be used when kidney function is completely gone. Typically, this happens when you're at end-stage renal disease. Okay, that's what this is. This is when your kidney function is completely gone, and so you're waiting for possibly a kidney transplant, or you're just hanging on. That's usually when they start dialysis. But until it even gets to end stage, so if you're in stage, there are 5 stages, right? So if you hit stage 3 or stage 4, dialysis typically is not going to happen for you. At that point, you're just going to keep, hopefully, using remedies and maybe taking medication to try to slow down this loss of function. Okay. So then we have urinary incontinence. This is when you can't control your urination. Okay, so you lose control of your urination. Like it just comes out. Okay, so, and this can be from a variety of different things. So if it's stress-induced incontinence, this will often happen when you're coughing, you're laughing, sneezing, and then you just accidentally, like some pee comes out, right? And then you have urge incontinence, and this is where you can't wait to get to the toilet. You can't even walk over there it's going to just come on out, right? Then you have overflow incontinence, and this is when the bladder is full and it's leaking, okay? Then we have functional incontinence, and this is when a person is unwilling or unable to urinate normally, okay? Then you have mixed incontinence, which can be kind of a combination of the first two, stress or urge. So you can't even wait to get there, or, and it could be like induced by laughing or induced by coughing, but then it just comes out, like all right there. Okay, so then we have an enlarged prostate. So almost all men with age experience BPH, or benign prostatic hyperplasia. Okay. Oh, this is an N, just so you guys know. Benign prostatic hyperplasia. So this is an enlarged prostate, okay, but it's benign. So malignant is when it's aggressive and deadly, and benign is when it's like a little bit more calm, okay. Anyway, so some symptoms of this will include longer to start urinating and frequent or increased frequency to urinate. So you have to go a lot more, and it just takes a while for you to, like, you just stand there and you're just like, come on, pee, come out. And it, it's just not, it takes a while for it to come out. Okay, so some treatment for this is recommended if you're suffering damage to the urinary tract, or if it is disrupting their lifestyle. Then you should take medications or possibly surgery, can help solve your problem, or you may use a catheter so that you can just go. Okay, there are two different types of catheters that they'll use for this. Usually what they're going to use for men who have this is going to be, I don't know if there's a better term for this, but if there's a better medical term, but condom catheters. So they just stick them on, and then it is attached to like a bag that will hold onto their pee, and then you just can empty it out. This is skin conditions. Okay, so skin conditions, now we're going to look at a couple skin conditions. First, we have senile pruritis, which literally means itching in old persons. Okay, so this is like, I don't know if you've seen maybe your grandparents or anyone else who they might have like, they just itch a lot, like especially, I know my grandmother will itch in her eye area like a lot, and it'll just be itchy, and then it'll start to get really flaky and all of that. This is usually caused by dry skin, okay, and so a good treatment for this would be lukewarm baths and lotion, okay. Underlying causes for this dry skin could be from lice or mites, could be from fungus, could be from allergies, or another chronic disease like diabetes. Okay, diabetes can cause giant itchiness. Diabetes can do a lot of other things. So many older adults may have stasis dermatitis around the ankles, okay, and around the ankles and the area which is actually more susceptible to injury and poor healing. And what that can do is they're more susceptible to getting cuts, or actually like just stubbing your toe on the corner of the wall or the table, right? And what that can do is if it breaks the skin, then, and if you have diabetes, your skin is probably not going to heal. You're going to have terrible healing. In fact, your immune system is already weakened, right? And this makes them so much more susceptible to allowing infection to just grow in that area. And if you don't keep it clean, or if they don't really take care of it right away, just stubbing your toe on something can actually grow into a bigger problem where it gets seriously infected, and that's when you'll see many times where they have to like just cut off like a foot or a toe or something like that, just because something like this happened. Anyway, moving forward, next we have skin cancer. Skin cancer is the most common type of cancer, okay, that's caused by a total lifetime of sun exposure. Okay, so of course it's going to be related to age, right? So basal cell cancer and squamous cell cancer is usually located on the face, forearms, or the shoulders, right? And then both of them grow really slowly and are actually very treatable, but you have to catch them in time. Then we have melanoma, which is uncommon, but the most serious. I think we've all hear about melanoma and then our skin crawls, like we get scared. Okay, so melanoma is uncommon, but it's the most serious, right? Moles, if you see a mole on your body, you should be checking that, especially if it's a new one that you're just suddenly noticing. Okay, those should be checked consistently and carefully examined for asymmetry, irregular border, uneven color, diameter, or having a diameter greater than 6 millimeters. Okay, so ABCD is an acronym, or an abbreviation for what you check for it to be a melanoma. Okay? Then we have Parkinson's disease. Now we're getting into neurological disorders. Okay, so Parkinson's begins gradually, but is disabling over a number of years. Okay, so some symptoms of Parkinson's disease could include tremors while you're at rest. So you can't really hold your hand like this and just rest it on something. You might kind of, get some of that going. Then there's slowness and a mask-like facial expression, just kind of like, or well, I can't really do it. But anyway, this is actually more common in men, and it's common in those who are a lot older. Okay, so if detected earlier, early treatment can include lifestyle modifications, eating more fiber, having more exercise, physical and speech therapy can help. Okay, and then medication can also help. Okay, so dizziness. Dizziness is not really a disease necessarily. It's a symptom, and it can be a symptom of having to do with other things. So vertigo is a sensation of movement felt in your head that like everything around you is kind of spinning. Okay, then we have disequilibrium, which causes unsteadiness in the body, not the head. Okay, then we have benign positional vertigo, which you can usually sort of get away with treatment. It's benign. This isn't as intense. Okay, so it might be just sort of, whoa. Okay. Anyway, so then we have orthostatic or postural hypotension, which can occur when you sit up way too quickly. Okay. Have you ever sat up way too quickly and then suddenly you're just like, oh, like maybe the blood hasn't, the blood kind of went down and you don't necessarily feel full up here, if that makes sense. It's something like that. So tinnitus is a roaring or ringing in your ears when there's no actual noise happening. Okay, and this increases with advanced age. Okay, it usually is caused by exposure to loud noise, but also can be caused by ear infections, and it could be a side effect of other medications and things like that. I don't know if you have all heard this or have had that happen, but I know I have. Especially I remember like as a child, because I used to get ear infections all the time when I was a child. So I just remember every so often like you'll get like a ringing in the ear, and it's kind of weird, but that nothing is happening and it's not actually a real noise out there. But anyway, so some treatment options include treating the underlying cause or focusing on stress reduction and white noise replacement. Okay, are we all familiar with what white noise would be? It could be just background noise, meditation music in the background, or I know like my grandparents typically always, or they would always leave the, when they go to sleep, they leave the TV on. It's low, but it's just right there. And apparently they love it, like that's their lifestyle, and they like the white noise in the background. Anyway, so next we're going to look at vision disorders. So first we have cataracts, And this is the leading cause of irreversible blindness. Okay. So cataracts are related to age usually, and they're just gradual changes in the lens as it thickens, it clouds, yellows, it becomes less elastic and all that, so your natural lens will start to change. Okay, so when cataracts interfere with life, then surgery is recommended. Cataract surgery is probably the most frequent performed operation in the United States. Okay. Then we have glaucoma. This is the leading cause of irreversible blindness. Okay, you can't really go back from this. Okay, so this is characterized by increased pressure within the eyeball due to a buildup of fluids, like too much fluid in your eyeball, and there's just a lot of pressure. Okay, so it can be acute, it can be a crazy episodic thing, but it's usually it usually develops slowly, okay, over time. So you don't even notice so much like the vision loss. It's going to be over, like you slowly, your vision will be reduced, okay? And there'll be more and more pressure built up. There is no cure for this, but there is treatment. The treatment can eliminate buildup of this liquid, this fluid, or you can encourage the drainage of the fluid. Okay. So next we have macular degeneration. So this deteriorates the retina that is responsible for central vision, causing blurred vision or blind spots. Okay, the dry form of this is more common and related to the aging process. Okay, the wet form, okay, so dry form is related to the aging process, and then the wet form is less common but accounts for greater vision loss. Okay, so treatment for macular degeneration is that it only works in the early stages. You have to catch this early on, and it's going to include laser therapy and medication. Okay, so that was the end of lesson 5. I hope you learned a lot. If you have any questions about any of this information, please leave a comment below or go ahead and email me or use any of the other methods of communication, and I will see you in the next lesson.